Good afternoon, everybody. Welcome and thank you for joining us. As many of you know, my name is Tim Miller. I have the pleasure of serving as CEO here at Broughton Hospital. First of all, I want to begin by extending my sincere gratitude to the Governor and to the First Lady for being here today and for their unwavering commitment to improving behavioral health care across North Carolina. And thank you for recognizing the importance of investing in the dedicated professionals who care for some of our state's most vulnerable citizens, and for your continued support of the Division of State-Operated Health Facilities. Today we're celebrating two tremendous milestones. First, Broughton Hospital, alongside with our colleagues at J. Iverson Riddle Development Center, are proud to be among the first state facilities to launch pre-apprentice programs that introduce students to meaningful careers in healthcare. Second, the Division of State-Operated Health Facilities, or DSOFT if I start calling them that, is excited to announce NC STEP, the first statewide apprenticeship agreement for nursing and behavioral health. This innovative model will build upon the pre-apprenticeship programs we are launching today by creating registered apprenticeships that provide a standardized, high-quality pathway to healthcare careers. Even more exciting, this model has the potential to serve as a blueprint for other agencies across the state. Our pre-apprentices are gaining valuable hands-on experiences each day. They work alongside experienced healthcare professionals. They observe patient care, learn about behavioral health services, participate in clinical and operational activities, are able to develop the skills and confidence needed to pursue careers in healthcare. Just as importantly, they are learning the compassion, teamwork, and dedication that define public service. Currently, here at Broughton, all three of our pre-apprentices are taking place in our NA1 or our CNA certification program, so that when they are done, they will be certified nursing assistants. Programs like these, though, are only possible because of strong partnerships. We are incredibly grateful to our partners from the North Carolina Business Community on Education, or NCBCE, some of you might have heard, Work in Burke, and Western Piedmont Community College. Together, we have created opportunities that connect education with meaningful careers while strengthening the workforce in our local communities. I also want to recognize our mentors. These outstanding employees volunteered to serve as teachers, coaches, and role models for our students this summer. Their willingness to invest their time and knowledge has made an immeasurable difference, and I thank each of them for helping shape the next generation of healthcare professionals. These workforce initiatives are making a real difference, not only for students beginning their careers, but also for the talented professionals who choose to build their future careers here at Broughton or at Riddle. And we're going to take the time to recognize one of the professionals we have is one of our newer nurses, Miranda Talbert, a registered nurse who works on our 2C unit, which is our geriatrics. Miranda shared that the state's investment loan repayment through the Office of Rural Health played a significant role in her decision to accept a position at Broughton. But her connection to Broughton began long before she came here as a nurse. She grew up in nearby Hudson, and her mother completed clinical training here. And while still in high school, she toured Broughton. That visit left an impression that she knew she wanted to build her nursing career here, so she pursued her education with that goal in mind, and today she is living that dream by serving our patients and community. Miranda's story reminds us that while we invest in our workforce, we are investing in people, families, and communities. We are helping dedicated professionals remain in rural North Carolina, strengthening access to care and ensuring that our hospitals continue to provide exceptional services for generations to come. NC STEP and our pre-apprentice programs represent exactly that kind of investment. They demonstrate what is possible when state government, education, businesses, and healthcare come together for a shared vision of building tomorrow's workforce. Finally, we are thrilled to have the 6 apprentices here with us today. 3 are from Broughton and 3 are at Riddle. Each had chosen to explore a career in public service right here in the home community, and we are honored to work alongside with them this summer. From Broughton, we have Adrian. He was on our healthcare tech pathway. He is in our CNA class, and he plans on going and continuing through the apprenticeship program with Western Piedmont. We have Helen, who wants to be a nurse. She's also working and earning her nursing certificate, her CNA. And Helen will be attending Western Carolina, pursuing her nursing degree. Then we have Georgina. She's also, just like with Helen, wants to be a nurse. So she's going to continue her pathway at Western Piedmont on a scholarship to pursue nursing. From Riddle, we have Camilla, who has worked in one of the homes on the Riddle campus, mentored by healthcare tech, and she will attend Appalachian State to pursue her nursing degree. Then Nigel and Trevor were both working in the maintenance and adaptive equipment program area. Nigel's going to attend NC State to pursue a degree in engineering, and Trevor's currently undecided, but hopefully will join the apprenticeship program to continue his work. We hope this experience has inspired each and every one of them to continue their journey in healthcare and perhaps one day return back to Broughton and Riddle to continue your work. But once again, we thank each of you for choosing us to start your journey here. And once again, I'm going to thank Work and Opt-in for giving us this opportunity to work with these individuals. At this time, I'd like to introduce Adrian Prackison, one of our mentors. He'll share a few words about his experience.
Thank you, Mr. Miller, for the introduction and inviting me to speak today. My name is Adrian Prackison. I am from Burke County, North Carolina. I am currently in a program called Opportunity Internship, also known as Work in Burke. I am currently enrolled in the Nursing Aid 1 NA1 program. This program has given me an incredible opportunity, and I am eager to continue to grow as a student. This program has given me great skills, leadership, knowledge, and direct patient care to begin first stepping stone for my future. This opportunity has shown me the behind the scenes of the skilled nurses and staff. It's been an honor to meet and talk with so many important leaders this afternoon, including the governor of our state, Josh Stein. After our conversation, it is clear that his priority is to create economic opportunity, invest in public schools, develop our workforce, and keep people safe. Governor Josh Stein, council, and workforce and apprenticeship is laser focused and strengthening North Carolina's talent, pipelines, and high demand industries, and creating real job opportunities in every corner of the state, especially for students like me. It is my honor to introduce the 76th Governor of North Carolina, Josh Stein.
How awesome was Adrian? Let's give him another round of applause. I assure you, when he agreed to do in March or April this pre-apprenticeship program at Broughton High School, he did not know he was signing up to speak to so many people in such a public way, but you hit it out of the park. Thank you. Tim, thank you for the tour, and thank the staff for the opportunity to learn more about Broughton Hospital. Just so impressed by the work that you all are doing here. Everyone, these young people behind me are dipping their toes into what will be an incredibly meaningful career opportunity. And we have 3 psychiatric hospitals in North Carolina, here in Broughton, and Morganton. We have one in Butner and one in Goldsboro, so the center, the east, and the west. Very pleased to be joined by Secretary Sangvai of the Department of Health and Human Services, and Dr. Carrie Brown, who is the state's chief psychiatrist. Senator Warren Daniel, good to see you here. Always good to be in your place of Morganton. These hospitals provide critical inpatient mental health services to people who need them. They help people get healthy, and they keep folks safe. In February, I signed a behavioral health and criminal justice executive order directing state government to coordinate our efforts to improve behavioral health and public safety in the state. The Departments of Health and Human Services, Adult Corrections, and Public Safety, along with the Office of State Human Resources, have been integral to the effort, and I want to thank them for their commitment, their focus, their dedication. I issued that executive order in the wake of several high-profile tragedies that happened across the state involving people who are experiencing severe mental health crises. The vast majority, the overwhelming majority of people with mental health struggles pose no risk to themselves or to other people. But there is a small minority of folks with serious mental illness who do pose a risk to public safety when that condition goes untreated. When they do have access to care, however, they're healthier, and everyone, including themselves, is safer. Over the past years, I've met with a number of behavioral health leaders, law enforcement experts across the state, learning about what was working and where there are real gaps in the system. And what I learned is that we are not investing enough as a state in behavioral health care. We are not investing enough in our behavioral health care workforce. At the Department of Health and Human Services, there is a long list of people needing inpatient mental health treatment in North Carolina. A quarter of our inpatient units, which could serve hundreds of North Carolinians, sit empty. They're there, we just don't have a person in those beds because we do not have enough staff to serve those beds. Here at Broughton, there are more empty beds than there are filled beds in this hospital. We have a desperate need to treat people with mental health care, and yet we have the great facility, a beautiful facility. We have the rooms, we have it all built, but we can't use what we've built because we don't have the staff to serve those beds. It is a travesty, and it deserves our attention. I urged the General Assembly to fund more behavioral health units in my proposed budget, but unfortunately the General Assembly did not. And even though the budget that I signed last week provided some support for state employees, the raises it provided don't keep up with inflation. So behavioral health employees are making less in real dollars today than you all did 2 years ago, when you were already not competitive with the private sector. If we are serious about keeping the people of North Carolina healthy, keeping the people of North Carolina safe, we are moving in the wrong direction. I am committed to working with the General Assembly to invest in people's health care, including behavioral health care, our health care providers, and our state's future. But even within these broader constraints, DHHS is coming up with innovative ways to tackle the workforce challenges. One way is through apprenticeships, is through these young people right behind me. This hospital and its neighbor, J. Iverson Riddle, have established the STEP NC Healthcare Apprenticeship. It's the first healthcare apprenticeship program in state government. These are it. You all are the inaugural class of healthcare apprentices. It's really simple. More people trained means more people working, which means more people served. Today, I got to meet some of these folks when we were in the room next door, these apprentices, and including Adrian. They're motivated, they're passionate, and they care about people. They want to help other people. Apprenticeships are just one way that the Division of State-Operated Health Hospital Facilities of DHHS is ramping up its recruitment efforts because we need more staff. They're also standing up same-day hiring events. They've invested in on-site CNA training. They've expanded the state loan repayment program to health professionals at these facilities. We just heard how one of the nurses came here because of that specific initiative. I applaud these efforts as DHHS keeps innovating to address the staffing needs to improve health outcomes, and I, like everyone else, look forward to their fruition. These are rewarding jobs with real career pathways, and it's a great opportunity for those who live here in beautiful Burke County. I want to say a word to all the folks who work here at Broughton, all the DSOF employees, including nurses, staff, apprentices, everybody who plays a critical role into the operation of this remarkable hospital. I enjoyed, Anna, the First Lady is here with me, we enjoyed our tour, learning more about what your day, what your life, what your work looks like. Y'all have chosen a really important career. You're helping people who are in some of the greatest needs of any people in this state. You are helping people. You're taking care of people. You're forming meaningful relationships with your patients. You're providing critical medical expertise. You're keeping them safe. You're helping them. I want you to know just how deeply grateful that I am for what you do for the people of North Carolina, and we are rooting for your success. It is now my honor to invite forward our Secretary of the Department of Health and Human Services, Dev Sangvai.
Good afternoon, everyone. Thank you, Governor, for that introduction, and thank you, First Lady Stein, for your ongoing focus on the important needs of our behavioral health citizens in North Carolina. I want to start by saying thank you to the team at Broughton and Riddle, and maybe go a little bit off script. I have a script. The tour today was really important because I think what I saw in the tour today is something we don't talk about enough. The numbers are important, the need is important, but it's also how you get there. And what I saw today is something that I think we really have to be proud of in our DSOF facilities, as well as what we're doing here specifically at Broughton. Not only did we see these wonderful young people behind us launching careers, but we got to see that care is delivered with kindness, with cleanliness, with friendliness, and gentleness. And I saw that on the tour today. And I oftentimes think we miss the importance if it's just not where you get care and how you meet the numbers, but how you deliver care. And so what we have now are students who are not only learning the science, the math, the leadership, all the other things to go with it, but they're also learning how you deliver that care. Because in the end, we're not going to meet our needs by simply meeting the numbers. We need the right people learning in the right settings, and this is the right setting for a program like this. So I'm really excited to be here today. Today is my third opportunity to tour. It's always exciting to come by and visit the team here at Broughton. I'm joined today with our chief psychiatrist, Dr. Carrie Brown. You're going to hear from her and some of the vision she has. I also want to take a moment and say thank you to Director Ashmont for the remarkable work that you've done to help us think about DSOF and running it like a healthcare system. As the governor mentioned, in order to cultivate a sustained workforce pipeline, we really need to embrace educational partnerships. And I hope the NC STEP program serves as an example of what really can be possible. I'm really eager to see what we can do in the future. You heard about some of the efforts that we're making in the agency to ensure that we inspire individuals to think about careers in healthcare. And what I think is really exciting, when I was a hospital president before, one of the things I would always talk about is there are those frontline individuals, the individuals who touch patients, if you will. And then there are those who quietly behind the scenes are doing remarkable work that enable that type of care. And I think what's really impressive about this pre-apprenticeship program is you see students who are not only interested in that patient-facing side of what's important, but also behind the scenes. The HVAC today is giving us cold AC because there is a team here working to make sure that that happens. So hospitals and health systems, facilities work when you have the people in front of the scenes and the people behind the scenes, and I think that's what's really exciting about the program that we have here today is that we're really focusing on things holistically. Last year at the agency, we also launched a first-time ever $10 million investment in loan repayment for behavioral health providers, really thinking about how to create those wraparound services. This includes providers across the state, social workers, psychologists, addiction counselors, and more. It's just one example that you heard about this from the governor of the investment that we're making in behavioral health and in the future of North Carolina. Our work at the Department in Workforce Development will continue through implementing other programs. Many of you may have heard about the Rural Health Transformation Program. We're planning to invest around $30 million into workforce, into our regional hub model, continue to find ways to really boost the talent pipeline as well as the capacity to care for patients in North Carolina. Importantly, strengthening our workforce does not have a one-size-fits-all model. I think we've seen that here today with the NC STEP program. It requires innovation to address challenges that people who make our systems that are working and those challenges that they face. From helping spark interest in our young people to investing in our young professionals, education, ensuring our seasoned professionals are getting the compensation they deserve, all very important things. Together we can build a sustainable workforce that is supported at every stage of their career. Again, I'm especially grateful to have Dr. Brown here and Director Ashmont here with us today. Both of them are leaders in our state facilities, have done a remarkable job in helping us think through the big picture needs of North Carolina. And at this time, I'd like to ask Dr. Brown to come forward.
Good morning, everyone. Thank you, Secretary. I appreciate the introduction. It is my great honor and privilege to serve as the Deputy Secretary for Facilities, Behavioral Health, and IDD, and Chief Psychiatrist. I'm grateful for the Governor, the First Lady, and their teams for their coming here in person today. Your presence is a testament to your support for our public behavioral health care system and a support for our DSOF employees who do heroic work 7 days a week, 24 hours a day, 365 days a year. Our facilities serve as an important safety net for North Carolina, providing critical care for individuals with complex needs. And now, through the NC STEP program, we'll be helping to bolster all of North Carolina's behavioral health care workforce. Of course, I have to brag a little, and DSOF is not new to innovation or to teamwork in crisis. Our entire system pulled together during Helene to keep the mission. And whether that be working tirelessly through the storm, as many of you here today did, or taking shifts at a sister facility, or caring for patients that we had to evacuate from our western facilities to our eastern and central facilities. Or, as Broughton did in record time, I don't know that it's ever been done, created, essentially overnight, a new inpatient opioid treatment program so that our colleagues at JFK could continue to run provide their substance use disorder services to the community during that time of incredible need. You'd be really hard-pressed to find a group of more dedicated individuals, and I hope that our current and future apprentices fall in love with public service, just like I did as a young medical student many years ago, I won't tell you how many, at John Umstead Hospital. And now I'd like to invite everyone to the chapel for a brief question and answer session.